Welcome to Scrubbed In, the DVM Journey, the podcast where we dive into the wild, rewarding, and sometimes unpredictable world of becoming a Doctor of Veterinary Medicine. I'm your host, Grace Gaynor, a current third-year veterinary student at the Virginia, Maryland College of Veterinary Medicine. Whether you're an aspiring vet, a vet student, or just passionate about animals, this is your backstage pass into becoming a DVM. From classroom to clinic, we're sharing the insights, tips, and real-life experiences to help you thrive on your journey to becoming a vet. So scrub in, and let's get started. Welcome back to another episode of Scrubbed In. I'm your host, Grace Gaynor, and today I'm hoping to give you guys a deep dive into the Virginia, Maryland College of Veterinary Medicine curriculum. Virginia, Maryland's curriculum is quite different compared to a lot of other vet schools, so today I'm hoping to give you a broad overview and answer kind of those common questions that people have about our curriculum. So let's go ahead and get started. So first I'm going to lay out how we do our core classes. So unlike at a lot of other vet schools, Virginia, Maryland has these big core classes throughout the semester in the first 2 years. And the purpose of that is to really tie a lot of ideas and concepts together. And you'll understand more when I explain these different, we call them mega courses. But basically, the purpose of the mega course is to tie concepts together. So instead of, for example, learning about the cardiovascular system, anatomy, in an anatomy course, and then having a separate course on radiology and being able to interpret different radiographic changes that you might see with different pulmonary or cardiovascular diseases, in our courses, we have those all together. So you'll learn the anatomy of the heart and the lungs, and then you'll have a class on radiology where you get to see if the heart is enlarged, what would that look like on a radiograph? If there's some type of pulmonary disease, what would that look like on a radiograph? And so it really ties those concepts together in a holistic way so that you can really connect and understand if I'm going through a case where a dog has heart failure, what is that going to look like? Anatomically, what is occurring during that? And also, what would that look like on a radiograph? And that's just one simple example of how that is done at our school in our curriculum. So let's go year by year, and I'll explain to you what courses you're going to be taking. In year one, in the fall semester, which typically begins at the end of August, you typically do have an orientation. It's usually 2 or 3 days prior to the start of the semester and maybe mid to late August. And then you jump right in at the end of August into your first course, which is called the normal animal. And basically in the normal animal, you're going to study normal individual behavior, social behavior, normal anatomy, normal radiographic findings, and things like that. So it's the first half of the semester, which is approximately, if the semester is, like 15, 14 weeks, it's, 7 or 8 weeks. So it's the first half of the semester, and you're going to be learning all about what we consider the normal animal. And in addition to learning normal behavior, normal anatomy, you'll also dive into more depth type things like cellular physiology and things like that. And this is a really great course because it really levels the playing field for people who have different backgrounds. Obviously, Virginia, Maryland does not have the same requirements as other vet schools. Typically, they have less requirements, which allows us to recruit more diverse and maybe non-traditional students. And so, obviously, that requires us to want everyone to be on the same page. And this is a course that really does this super well. It reviews all the basic anatomy, it reviews all the basic physiology, and introduces us to some new concepts that maybe we're not familiar with, like radiographs. Again, it's a really great way to level the playing field, make sure that everyone has the same base knowledge before we get into the nitty-gritty of vet school education. So that is the first half of the fall semester. Second half of the fall semester, you're going to have a class called Dealing with Threats. And this class is notoriously quite difficult, but it really depends on your background and what your strengths and weaknesses are when it comes to studying. The course is a big overview on all the bacterial, viral, parasitological, and toxicology agents of domestic animals, and also covers a lot of how diseases are transmitted. And in addition to that, and it's also a good overview of how we diagnose and treat some of those common bacterial, viral, parasite conditions and things like that. This course is definitely a lot. It seems like information overload at first if you don't really have a good study strategy going for you, but I think as I've talked about with other guests, if you have a good study strategy going into dealing with threats, a lot of people do just fine. One thing that is interesting about our curriculum is everyone struggles in different classes just because each class requires a little bit of a different strength. So dealing with threats, definitely a big class of not only memorization, but also categorization. So understanding these type of bacteria, gram-negative bacteria, have similar characteristics and things like that, and being able to group things like that. So that is what your fall semester will look like in your first year. In addition to those 2 courses, you will have a semester-long course called Becoming a Professional 1. These courses are just a way for us to get a little bit more insight into the nitty-gritty of how we will be good veterinarians, so helping us develop our leadership and communication skills. The course is overall comprised of 3 semesters, so this is Becoming a Professional 1, and then you'll have 2 other semesters of Becoming a Professional, so that will be something that you do throughout your 4 years here at Virginia, Maryland. And, as I mentioned, it's just a great way to overview different legislation, personal finance, personal skills, practice management, professional behavior, and help us develop those soft skills that are really important for becoming excellent veterinarians. Then obviously you're going to have your winter free, and then you're going to have your spring semester. In the first half of your spring semester, in your first year, you're going to have a class called Moving. This class is very heavy on anatomy, specifically pertaining to the musculoskeletal system. It also covers common diseases of domestic animals that are related to the musculoskeletal system. And then there are also discussions on the diagnosis, treatment, and control of these diseases, specifically like pain management. We do a lot of analgesia in this course, which is a really great intro into a lot of different drugs that are very important to know when you become a veterinarian. A lot of people think this course is quite difficult because there is a lot of anatomy. You are in the anatomy lab every day doing dissections on a lot of muscles and things like that. So pretty involved course, but if you can get the anatomy down, you're going to be well on your way to being successful in this course. And in a bit, I will go through kind of what a regular day looks like at Virginia, Maryland, so you have a better idea of, how many classes per day you'll have and how many labs per day you'll have. But back to the course schedule, just to recap: fall semester, first year, the normal animal, then dealing with threats. Then you also have Becoming a Professional 1 throughout the fall semester. Then in your spring semester, first half, you have Moving. Then you're going to have another course in the second half of the semester called Sensing and Seeing. And this course is really a phenomenal course to talk about just everything related to the nervous, ocular, and dermatologic systems. And obviously, we're going to go over the common clinical diseases. One thing that really challenged me in this course was neurolocalization, being able to localize a neurologic lesion, which I think a lot of students do find challenging. Being able to treat dermatologic conditions and ocular conditions as well. So that was probably one of my hardest courses, and I think my class in particular really struggled with that course, but it really just depends from year to year what class people find most difficult. I think neurology is just a general topic that people can struggle with, but again, that is just something that we need to know, and this was a great course for learning all about that. In addition to that, in your spring semester, throughout the whole semester, you'll have Becoming a Professional 2. So we do have another round of that class where we get to hone our leadership skills and other soft skills that we need to be a veterinarian. So that is your first year at Virginia, Maryland, and then you're going to have the summer off, which is really nice. Definitely recommend enjoying it, because the summer after that, you will be in clinics. So I will get to that, but this is your summer that is going to be free, and so you want to take advantage of that. Definitely recommend working if you have to, but also taking time to do some fun things, maybe travel and see family. All right, moving into second year. The first course of second year is a course called Breathing and Circulating. And I think I kind of mentioned this earlier and touched on it, but we study the cardiovascular, hemolymphatic, and respiratory system. We talk about radiographs, which is so important, especially for the cardiovascular system. We also discuss pathology, but big things that we love talking about are how to diagnose and treat a lot of those cardiovascular conditions and respiratory conditions. And then we also touch on general anesthesia of veterinary patients as well, which is obviously very important and very pertinent information. Second course is eating and eliminating. And in this course, we talk about everything related to nutrition, to GI anatomy, and endocrine diseases, metabolic diseases. This is a really big and important course, all the nitty-gritty of a lot of common diseases that we see in small animals and horses. If you want to talk about colic, if you want to talk about pancreatitis, Cushing's disease in dogs, all of that stuff is covered in eating and eliminating. And it's a really great course that, as I've mentioned before, really takes the anatomy, the physiology, and puts it together with some of those really common diseases that we see in our small animal and large animal species, and also how to treat those common disorders. Winter is free, and then in the spring semester of your second year, you'll have a course called The Next Generation. Now, this is a really exciting course, and I want you guys to remember this. The Next Generation is the first course of your second semester of your second year, and this is where you get to do your first spay. And this is really exciting because you get to do it so early on in your DVM career and in your DVM curriculum that it really helps you gain confidence as a DVM student. And the reason that we do that here in the second year is because in the summer, after your second year, you go into clinics. So they want us to have that surgical experience going into clinics. And so in this course called The Next Generation, the course goes over the anatomy, physiology, pharmacology, and medical aspects associated with conception, fetal development, gestation, delivery, and lactation. And also we cover different things related to neonatal development and disorders and how to manage those. So this is a pretty difficult course, I found, especially with cycles in our bovine species, specifically how to sync cycles and things like that, but very important and very interesting. And you get so excited in this course because you're learning things that are going to help you during your spay surgery, and that really helps tie together a lot of important concepts into real life and see how it plays out when you do your spay. So that is the first half of your spring semester in your second year. And then in the second half, you're going to have a course called Healthy Populations. This course really is an overview about different epidemiology concepts you need to know, biosecurity. We do talk a lot about population medicine, herd health, and how to prevent disease in herds. So that is a really important thing to learn, especially for our food animal practitioners. Obviously, we love to talk about One Health concepts in this course, how the intersection of human medicine, veterinary medicine, and environment and environmental health intersect. We also talk about meat hygiene. And one thing that I really loved in this course is we talk about exotic medicine, so not only pocket pets, but also some of your aquatic species like fish and things like that. And that was really interesting. So super cool course. While this course is going on, you still have surgeries, so it depends on when you get scheduled for your surgery. It occurs all the way through the spring semester of your second year, so throughout those two courses, spay lab, as we call it, continues to go on. Also, during your spring semester of your second year, you're going to be in a class called Intro to Clinics, and the purpose of that class is pretty self-explanatory. It's just to help you get prepared for clinics, learn how to use our software system, which is called EasyVet, and how to create records and things like that. Good course, good ideas, really just trying to help you feel comfortable before you head into clinics that summer. Obviously, you finish your second year and you head straight into clinics. So this is where our curriculum deviates from a lot of other vet school curriculums. We have our first 5 clinical rotations in the summer after our second year. Each rotation is 3 weeks, and we get to rotate through either rotations inside the hospital, because we do have a teaching hospital here at Virginia, Maryland, or you can get scheduled for externships as well. Usually it's a good mix, but I do know some people that only had internal rotations, so they stayed here over the summer. The purpose of this is to really help us after we have gone through the first 2 years of our curriculum, which here at Virginia, Maryland, we consider our core curriculum and really everything that we need to know as veterinarians. It really helps us solidify that knowledge and get to practice a lot of the things that we've learned. And personally, I found as a second year, at the end of the year, I was really excited to get into practice, just kind of getting a little bit of that itch, right? Feeling like I'm ready to put into practice some of the things I had learned and feeling excited about having the opportunity to work with patients and talk with clients. So that is a big perk of doing vet school here at Virginia, Maryland, is getting to do those rotations early. And the big purpose of that as well is not only to put into practice what you've been learning, but also at the end of your third year, you have the summer free. And so the purpose of that is to give you time without classes, without clinics, so you can study for the NAVLE. I do think this is a big contributor into why we have such a high NAVLE pass rate. Now, of course, there are students, I'm sure, who don't study for the NAVLE appropriately over that summer because they have free time, they just travel or whatever, and that can end up poorly for them. But if you use that summer well, it really sets you up well that when you go back into clinics at the end of the summer, you are feeling pretty good about the NAVLE and you don't have to prepare for the NAVLE while you're in a full year of clinical rotations. Now, after you've done those 5 rotations, and you will get a break during those 5 rotations. I know it probably sounds like a lot to go straight from those classes in your second year into those 5 rotations. For this year's second years at Virginia, Maryland, they have a week or 10 days off before they start those rotations. For us, for our year, we had a week off at the end of our rotations. So it does vary, but you will get a week off. I think they're probably going to consistently give you guys a week before the start of clinics to have a week off between the end of classes and the start of clinics, but I don't really know for sure. But you do get at least a week off so you can travel and see family if you need to. Now, after you complete those first 5 clinical rotations, you go straight back into the classroom for your third year. Now, in your third year, it's not like in your first 2 years where you had those mega courses. Now it's back to having regular individual courses, and you take these courses based on your track and based on what you choose to take for your electives. At Virginia, Maryland, we have 5 tracks. We have a small animal track, a food animal track, an equine track, a mixed animal track, and a public corporate track. So obviously the small animal, food animal, those ones are pretty self-explanatory. Mixed is really just a variety. I can get into tracks a little bit more in detail on maybe another episode, but mixed is really just an opportunity to try a bunch of different things. Mixed trackers get second priority for all of the classes that have a cap on them. So anything with a live animal lab, mixed animal trackers get basically first choice after the trackers to get into that class. And so there are pros and cons to picking that track. I personally am a mixed animal tracker and I love it so much. So happy to answer any questions you guys might have about that. Public corporate, people like this one because it has the most externals. And so you get to travel more. If you're looking to do something in the government, there's more flexibility. I know people who want to do zoo medicine, so they have more external rotations to get connected with zoos, and so they choose that track. I also know someone who's interested in doing pathology, and so she is doing that track because it allows for more flexibility, and she's not interested in going into clinical practice, so that allows her to do more non-clinical rotations as well. So that's a little bit about the tracks. For the third year, we have so many different courses, and I think that I'm just going to briefly go over kind of what we offer, just so you have an idea of what we offer. But it is different from the first 2 years in that you don't have those mega courses. So it's more of individual classes where you have to, study for those exams individually, and you can have more exams than in the first 2 years. So you really have to choose your classes wisely. If you're tracking, for example, small animal, you'll be automatically enrolled in all of the small animal courses that are required for your track, and then you'll have the opportunity to enroll in some electives that may interest you. So you really just have to choose, whatever courses may interest you, and then also try not to sign up for too many classes, because then you'll be having a lot of exams and things like that. So in the fall, small animal classes that we offer are dentistry, ophthalmology and neurology, surgical diseases and techniques. And for the surgical disease class, you will have the opportunity to perform a neuter as well. There's also small animal theorio and things like that. So those are some of your small animal courses that we offer in the fall. For equine, we have a course in the fall called Breathing, Circulating, and Moving, and then also a lab associated with that. For the lab, we got to do some endoscopy and things like that. We went into the guttural pouch and things like that. We did abdominal ultrasounds. So really interesting things to do in that lab as well. We also have equine podiatry. I also took that class. Great class to learn about the biomechanics of the foot, how to shoe properly, and how to interpret radiographs associated with the foot and shoeing. And then also equine problem solving, where you get to interpret and cover some common diseases. Other track courses for food animal, we have food animal theorio, food animal clinical techniques. In this course, you get to practice dehorning, castration, injections, doing some nerve blocks, tagging and planting, and basic handling techniques for sheep and swine, things like that. I was in that course, really great course, definitely recommend. One of our popular courses is food animal medicine and surgery. This is just a great overview of all of those food animal diseases and surgical diseases, so a lot of people try to take that for NAVLE prep. Other options related to the public corporate track are veterinary careers and pathways, where you get to learn about different unconventional tracks or jobs in veterinary medicine and things like that. So that's just a brief overview of what we offer in the fall. In the spring, we've got small animal oncology, small animal ER, nutrition, small animal medicine. This is a great course. I'm in it right now. It's super hard, but we go over literally everything like hypertension, hypercalcemia, abdominal disorders, things like that. So very valuable course. Special topics in equine clinical practice and a lab associated with that in the spring. For this equine class, you will be able to perform a castration on a horse, so that is a really great course. There's also another equine course called Diagnostic Techniques, where you can do more nerve blocks and things like that. And so that's kind of what we offer on the equine side. On the food animal side, food animal clinical reproduction. We also offer a repro class in the fall for food animal, where you get to practice AIing and things like that. My friends are in it and they really have had a good time. Also doing a BSc, which is a breeding soundness exam, and things like that. Overall, those are the track courses that we usually offer in the spring and fall. There are also some elective courses that we offer. Ferret medicine is one of the favorites. We have some veterinary diagnostic courses in both semesters that are really awesome. We have small animal physical rehab, compassionate end-of-life care. We've got zoo medicine, which I was in that course. It's awesome. In the spring, we've got decision-making in veterinary pharmacology, reptile medicine, equine sports medicine and rehabilitation, and things like that. Really, a lot of variety in the courses offered in the spring. I'll put a link for this episode so that you can read the PDF catalog that they have for previous courses, and you can just peruse that, but really just a lot of options here. In the spring semester of your third year, you will also have your third Becoming a Professional course. Right now, we've been talking a lot about contract negotiation, also how to get appropriate licensing and things like that. So also a valuable course. And then, as I said, after your third year, you have the summer off, and that is where you're going to be doing your NAVLE prep. And then at the end of the summer, probably towards the end of August, you're going to start the rest of your clinical rotations. You'll have 12 blocks left, and you'll complete those as well. So that's kind of an overview of the curriculum. Hopefully that was helpful. Now I want to briefly touch on what a typical day at Virginia, Maryland will look like. In the first 2 years, it's pretty consistent, but you basically will have approximately 4 classes in the morning from 8 to 12. Our classes are 50 minutes each with a 10-minute break in between. So you'll have approximately 4 classes from 8 to 12, and then you'll have a lunch break from 12 to 1. And then there's typically 1 or there can be 2 labs in the afternoon. Typically, you'll be assigned a 1 to 3 p.m. lab or a 3 to 5 p.m. lab. Now, obviously, if you have a 3 to 5 p.m. lab and there is not another lab, you'll have a break from 1 to 3. So there are a lot of students who will sleep in, watch the recorded lectures, which are usually posted approximately 30 minutes after a lecture ends. They'll watch the lectures and then come in for the lab. But it really is up to the individual student, and it does vary based on the schedule. That is basically an estimate. It doesn't always work out that way, but for the most part, it's pretty consistent that is what you'll expect for the first 2 years. There are occasional days where you'll have 8-hour lecture days, and then other days where you'll have multiple labs. Instead of labs in the afternoon, you'll have them in the morning and things like that. But for the most part, that is how the schedule works in the first 2 years. In your third year, you can have classes at random. The schedule is not consistent. For me, my schedule varies every single week. It depends on the class. Sometimes I'll have a lab-heavy week. Sometimes I'll have a lecture-heavy week. And it really just varies based on what courses you're in. I do think they do a good job based on your track. So for example, if you're an equine tracker, they do a good job spreading out, for example, all the equine exams so they're not on top of each other, and they spread out the equine labs as well so you're not going to be slammed. I do think for mixed trackers is a little bit more of a free-for-all, but I personally still love the mixed track. Another thing people often wonder about with our curriculum is how often you're tested. Now, I think this is a real highlight of our curriculum, but in the first 2 years, you're going to be tested approximately every 2 weeks on Mondays. This is vastly different from other vet schools where you can have multiple exams in one day or 1 week. That does not happen at Virginia, Maryland. You may have an occasional week where in the first 2 years, you have 2 exams. For example, a lab exam and a lecture exam, maybe on the same day or in the same week, but for the most part, it's 1 exam every 2 weeks, with the exception of that occasional lab exam that's going to be maybe like on the same day or in the same week, or when you're approaching your final exam, maybe you have a third exam and then your final exam in the same week. But for the most part, it's really not like you're getting tested all the time. And this is a big difference between other schools. I was just talking with a couple students from LMU, not to throw shade at LMU, but they have 4 exams today, and one of them's a final exam. I have never once at Virginia, Maryland, and never will I ever take 4 exams in one day. Now, there are pros and cons, obviously, to how often you're tested. The pro is that you're not tested as often here, but it does mean that all of your exams are a little bit higher stakes. They're worth more of your grade, but it's really not that bad. And to be honest, I really think that being tested less frequently allows you more time to digest the information. Now, if you have lectures the Friday before a Monday exam, you probably are not going to have as much time to digest that information, but you're still getting more time than the person that's probably getting 4 exams on a Monday and they still have lectures on a Friday, you know what I'm saying? And so they're not getting enough time to not only learn that information, but they're also balancing 3 other exams or 4 total exams, so they have to prioritize their time. So, big perk, really not tested as often. I really think it helps you learn better and kind of decreases the amount of cramming that you have to do. Now, in your third year, we are not tested on that 2-week schedule. Obviously, every course is different. You'll be tested at different times. Prior to spring break, I had 5 exams in 1 week, but really, after hearing that someone had 4 exams in one day, I also know other students at other schools that have had 5 exams in one day. I'm not complaining that I had 5 exams, 1 each day during 1 week of my entire vet school career. Like, that will never happen again. So really, we do not have it that bad. I think they're very kind to us, and I really think it's more conducive to learning. I'll get off my soapbox about that now. But the only other thing I want to mention is after having a bye weekend, basically the first 2 years, every other weekend you have a bye weekend is what I essentially call it, where you basically can study but without the pressure of having an exam on Monday. I think that is so important to prevent burnout. I didn't realize how important that was until third year, where in the fall semester, I had exams pretty much every week, which again, not complaining, but it did seem kind of fast paced because once I finished one exam, I was studying for the next exam, but ultimately not too bad because I was able to, keep moving through it. But I realized that because those first 2 years I usually had a bye weekend, I was a lot more ready to take on that challenge third year with more exams. I think if I had had that many exams, like every single week or multiple in one day, I would have been super burnt out. So I think our curriculum is really awesome in preventing burnout and also super conducive to learning. But that is just kind of a summary of what is involved. And I hope that was helpful for you. But if you have any questions, feel free to leave a comment and I will try to make another episode that clarifies things, but that's just a general overview. And I hope to make another episode that does a little bit more of a deep dive onto the different tracks and the pros and cons. But for now, I think that this is a good overview of our curriculum and what we have to offer. So I hope that was helpful. And with that, my name is Grace Gaynor, and I am scrubbing out. That's a wrap for today's episode of Scrubbed In, the DVM Journey. Thanks for tuning in and being a part of our community of future vets and animal lovers. If you enjoyed today's episode, don't forget to subscribe, rate, and review. It helps others find the show and join the conversation. And if you have any questions or topics you'd love to hear about, feel free to leave us a comment. I'd love to hear from you. Until next time, keep scrubbing in, and remember, the journey to becoming a DVM is one step at a time.